Yeah, I wanted to express my particular concern about the number of deaths that I believe are avoidable to coronavirus, especially among the Latino population and other people of color. Um, we look at the data. So Latinos aged 35 to 44 have a mortality rate 8 times higher than their white counterparts in that age group. I can't think of another, situation where the disparities are that great. Uh, If I could show you on a graph, it'd probably be a little bit more obvious. But these numbers are hugely disproportionate. Um, we have this inequity persists with age groups 25 to 34 and those 45 to 54, according to this new Harvard analysis that came out of the National Center of Health Statistics that showed um, the huge differences from 8 times to 10 times among these different groups. A new Brookings Institute analysis showed that the coronavirus is killing Black and Latino adults in their mid 30s and mid 50s at levels 6 to 10 times higher than their white counterparts. Also, now approximately 1 in 3 low-income immigrant families with children are going without public benefits like health coverage, food stamps, because of fear of public charge. That's an increase from just over 1 in 5, which was last year's numbers. So before it was 1 in 5, now it's 1 in 3. Over 1 in 10 said they avoided housing subsidies. Some adults reported avoiding public programs that are not listed in public charge, including free or low-cost medical care programs for the uninsured. That was 21% in the survey. The SNAP program, 16%. Marketplace health insurance coverage, 14%, and free or reduced price school lunches, 13%. These are not part of public charge, but they were avoided because of the fear that it might be included or that it could be associated with those programs that are included in public charge. Also, avoidance of these programs is particularly worrisome in families with children because the entire family faces the financial hardships, the psychological distress, and problems in accessing healthcare if it only affects one person. It then trickles down and eventually affects the entire family. Nearly 80% of adults surveyed didn't know that their children could enroll in Medicaid without affecting their parents' legal status.